organizational behavior, counseling, and positive psychology. She has 55 research publications in various journals, and she published 2 books, supervised 17 PhD scholars, and now 3 in her hand. She has attended and presented papers in several conferences and seminars of national and international reputation. And she has membership in many organizations, and she is also awarded as the best NCC officer. Such a reputed person you are, ma'am. We are very happy to have you in our midst. As chairperson, I request you now to kindly address the gathering.
Thank you. Good evening and namaskar to all of you. Especially Professor D.G. Reddy, the President, World Congress of Psychologists, other senior consultants and patrons who are there, and other members, the committee members who have organized this program, a wonderful program, and all this budding counseling psychologists who are the participants of this program. And this is the very good, I think, training program which they have started for 3 months. Definitely it will help them in developing as a psychologist, as a counseling psychologist. And I'm really very thankful to Professor Reddy for providing me this opportunity to be a part of this training program, which has been organized to train you all for providing and the support services which you will learn in your training period. You will be trained for that. And then you will be applying those things in your school setups where the children will be having certain issues or problems in day-to-day life. So as we all know that this course definitely will empower you when you are completing your 3 months. It will shows that it empowers you to apply the skills of counseling in your school settings and wherever there is a need for it. So you must have gone through the basics of counseling, which is the very essential skills, we can say, the micro skills. And you must have learned by the time now how empathetic one can be to become a counselor. So what characteristics are needed to become a counselor? Self-introspection is very much required for this. Then only we can say that, okay, we have learned something and we can apply all those things. So we have to just see as what potential the trainers are having. And this all will be, as I have noted that in a week, 2 sessions were there. In those 2 sessions, definitely you have to practice the things, not only the classes there, but you have to practice. And certainly the issues which you are seeing in your day-to-day life as a school teacher, as maybe you're nearer and dearer in your community services, wherever you go, you see the children everywhere. So what type of problems these children are facing? And when we talk about this COVID-19, so what is pre-COVID and after that? The situation is totally changed. And in that, the children are definitely into the fear, the phobias which are there, how to handle them. They are in the nuclear families where there is nobody to talk to them and they cannot discuss their issues. So there is a need of some support, some psychological support from the person other than home also. So here the teachers are the most important ones, or you can, if you are not a teacher, then also the counseling can be done for different issues. And we have to see that whatever will be the takeaway from this course, you must feel that I can do something for the betterment of these children, for the betterment of the society, and it will definitely help you and give you the self-satisfaction. And children will also be self-sufficient when you try to build up the confidence in them. If you have the commitment to do this, definitely you will pass on to your children's also in the same way. Thank you.
Thank you very much, ma'am, for your encouraging words and for reminding us of our responsibility in school counseling. Thank you very much. Now we have with us Dr. M. Srinivas as our special invitee. I request you, sir, to kindly share your thoughts with the group. And before he begins, a small introduction about Dr. M. Srinivas. He has completed PhD from Bangalore University. Over 18 years of teaching experience, he served as BOS chairman and Board of Examination chairman and chairman of other committees of Bangalore University. He has presented more than 40 scientific research papers in various seminars and published more than 30 research articles in several journals of national and international reputation. And he is also a good sportsman. He won 3 gold and 2 silver medals in national taekwondo championship and 5 times state championship. He created Guinness World Record with Rotary Bangalore South. At present, he is working as BOS and Board of Examination Chairman, Bangalore Central University, Vice Chairman of Association of Gerontology, Varanasi, and President of Karnataka Association of Applied Psychologists. Sir, a very reputed person you are, sir. We are very, very happy to have you in our midst as our special invitee. I request you now to share your thoughts with the group.
Thank you very much, madam, for inviting me this prestigious organization. I extend my sincere thanks to Professor Govind Reddy for inviting me for this session. Especially, I feel proud that Dr. Ashok is my guru. He is the one presenting today, and also all the esteemed members are there. So, due to some reasons, I was not able to join the actually this organization in the initial stages, even though I am a member of this organization. But sure, definitely in future I will actively involve, and definitely I will try to contribute my level best, and the input what I am receiving, definitely I'll contribute to transfer those information to the younger generation. That's what I have the motto. So thanks for inviting this prestigious organization and this training program. Thank you very much.
Thank you, sir. You are a part of our WCOP community. We are very, very happy to note this. Now we have with us the resource person of today's session, Dr. Ashok. I request you, sir, now to take over the session and lead the session. To speak about Dr. Ashok, he is as adjunct faculty at the Center for Education and Social Studies. He served as BOS and BOE chairman and faculty in the Department of Psychology in Bangalore University for 35 years. He guided 14 PhD scholars and now 4 at hand at present. He wrote many articles and study materials and modules. He published 15 papers in various journals of national and international reputation. He conducted workshops, seminars, and refresher courses. And as a core committee member, he is also a good trainer. Sir, we are very, very happy to have you with us today as our resource person. Now I request you to take over the session and continue with the session.
Thank you. Thank you. So, first of all, let me thank the WCOP and Professor Reddy for inviting me to share some of my thoughts about group counseling. I was told that I have around 30 minutes, 30 to 35 minutes to share my thoughts. So, assuming that you know the basics of counseling, skills of counseling, I will not touch about that. So, I will be emphasizing on what is group counseling, and probably when you are talking in terms of a group counseling, what are the factors that need to be considered, what are the challenges, what are the ethical issues that need to be taken into consideration while doing a group counseling, and probably some of the factors that you have to keep in mind in order to be effective in group counseling is concerned. So these are some of my observations or my thoughts on the group counseling is concerned. So when you look at, let us say, group counseling, it is a process where collective group is there. When you say group itself, there are a number of individuals who are there. Similar issues and concerns are there. And when you look at the similar issues, so people sharing a common issue or a common problem come together to resolve a particular issue, and how this, let us say, issue can be handled is the primary focus of the group counseling is concerned. Now, if you trace, let us say, counseling itself or the group counseling itself, the history of group counseling, the first, official record of group counseling can be traced to 1905. So in 1905, we find that, the first group counseling was started with tuberculosis patients. So that is where from 1905 it started. And every decade, there is some improvement or some, additional groups that went on. And probably the latest thing which we have, I think September 19 attack resulted in a significant contribution or request for group counseling was there. And now you're all, victims or succumb to the pressures of pandemic. And pandemic has also resulted in, the need for the group counseling. So this is very briefly with regard to the history of, let us say, counseling is concerned, or a group counseling is concerned. Now, when you look at group counseling, there are certain factors of importance when we look at, let us say, group counseling is concerned. Why it is important is because I'm not going to talk about advantages and disadvantages of counseling, group counseling, but rather it is understood that, it has a better advantage. And what are the factors? I think that covers the disadvantage or the demerits of group counseling is concerned. So I would be focusing on what are the factors of importance in group counseling is concerned. When it compared to the individual counseling, the factors of importance to the group counseling are, the first one is the installation of hope. Now, when we said group counseling is a group which is having a common problem or a common issue, all of them are in a particular mental state. Okay. So the first and foremost component of group counseling is that installation of hope, in the sense that, everybody is sailing in the same boat. When everybody is sailing in the same boat, now probably
Sir, Dr. Ashok, please unmute yourself.
no,
We are
I
not
got
able to hear you.
I got a message that the host has muted me. Now I have got a
Maybe,
message.
yeah.
Okay, right. So the factors that that are of importance for group counseling are, the first one, installation of hope I was talking about. An individual may have a problem. An individual may say, I only have a problem. When people are having the same problem come together, it gives a sort of a confidence that I am not the only person to have this problem. Others also are there. That is where the installation of hope comes into a picture. So the first factor is the installation of hope. The second one is universality. As I said, the problems are of a universal nature. Say, for example, we are talking about pandemic and how to deal with this particular pandemic. There are every day and night you hear a lot of let us say, when you switch on the TV. I think at the time of pandemic being a peak, one of the effective methods of coping was that turn your TV to the wall side, because if you switch on any TV, you will find a lot of individuals, a lot of deaths, and a lot of victims, and etc. And that's where it gives you it goes into depression and component. So the best way is to turn your TV to the wall side, so that you can handle that particular. So universality is the second factor. Information giving. So the entire process of group counseling is that sharing of experiences, sharing of information is a factor. Then altruism. So ultimately, the welfare of a larger section of the society is an important factor when we talk about the, let us say, group counseling is concerned. And corrective recapitulation. Now, what do you mean by collective recapitulation? People who are participating in the group, let us say, group counseling, tend to recapitulate their feelings, their experiences, and it is in a collective form. So the manner in which each one of them have handled this particular issue, some may be right, some may be wrong. What is right to an individual may be a wrong to another individual. What is wrong to an individual may work well with another individual. So when sharing of information, recapitulation of ideas comes into the picture, that will have a altruistic tendency can be handled. So that's where we talk in terms of altruism. Collective recapitulation is possible. Imitative behavior. So another important factor would be it facilitates the imitation. So imitation here, probably we are all familiar with the term what is called as modeling, and the counselor here itself can be a better model so that that particular behavior can be imitated. So imitative behavior is one. Interpersonal learning is another factor. Okay, as I already talked to you about corrective recapitulation. In the process of corrective recapitulation, now interpersonal learning can take place. So individual come to know better of the other individual, and they may see that the plight or the depression or the problem I have, the degree or the severity may vary when I perceive another individual experience. When I hear the experiences of another individual, I know that whatever I am experiencing is much less than the other individuals are concerned. So interpersonal learning is possible. And group cohesiveness. So another factor of group counseling is that cohesiveness group. At the end of the counseling session, at the successful end of the counseling session, the group becomes cohesive, and that cohesiveness can have a long effect, and then that can have a longer period of the positive effect on the individuals are concerned. And then when you talk in terms of let's say the catharsis is another factor. Okay, as an individual, when it comes to individual counseling and the group counseling, individual counseling, a person may have his own reservation in sharing out that particular experiences. Nowadays, especially in the urban society, we find that people may not find have confidence in their own kith and kin or family members itself. So when you can share out your experiences, that catharsis component itself can have a ironing effect on dealing with the problem or concern. And ultimately, when you talk in terms of group counseling, the existential factor play an important role. What do you mean by existential here? Going back to the philosophy of existence itself. So you are dealing with a problem that can have threat to your own existence is concerned, and the existential concern is another factor of importance to the counseling, group counseling is concerned. Probably there is not much of a difference in the stages of counseling, whether it is an individual counseling or a group counseling. So, the initial stage, the transition state, the working or the action state, and the final, interpretation and termination stage is concerned. I think the stages of group counseling and the stages of individual counseling are almost the same. Now, the factors affecting effectiveness of group counseling are, the first one is time and place. When you are conducting the group counseling and where are you conducting this group counseling is an important factor. I remember very well when I was in the degree study. That's where way back in 1970s, early 1970s, there was an American psychologist who had visited India as a Fulbright scholar. So he was studying, or his main focus was counseling. He approached my college and said that I facilitate the counseling process. So the principal got hold of some of us, about 20 students, who found it difficult to say no to the principal's request. So he said 20 people would be sufficient enough. At the end of the college hours, so we used to complete college by around 4:30, and 4:45 he used to come. This particular counseling psychologist has to come and ask us all to sit together. And he used to say, start the counseling session saying that, so I got up today morning, the weather was very pleasant, and I had a cup of tea, and it was very bright and all that. And then he started encouraging any one of us, all of us, one by one, to share our experiences. Now, what happened? All of us totally from a different culture. Okay. And that too 20 individuals whom we do not know, what were not friendly at all. And then at the end of the college hours, and he said that you have to share your personal experiences, whether it is pleasant or unpleasant. And when we have a belong to a particular culture, whatever the problems that are there in front of the, let us say, outsiders or external people, we should not expose ourselves. So when that happened, later on, the first session was 20 people. Second session, it came to 18. By the third and the fourth, people tried to find another back gate and then walk off. So when you say group counseling, the first factor that you need to take into consideration is the time. When are you conducting this particular group session, and where are you conducting this particular group session? Now, suppose, for example, if you are talking in terms of group counseling at a school setup, group counseling at a work setup. So whether it is advisable to conduct the group session in the school or in the workplace, in the office, or whether you have to call the people, call the clients to, let us say, the counselor's office or counselor's clinic or a center. So all these has its own advantages and disadvantages. So one may have to look into the nature of the problem that the individual is handling or the counselor is handling, and appropriately the time and space have to be determined. So the effectiveness of group counseling depends upon the time and the place. The second factor that affects the group counseling is heterogeneity and the homogeneity of the group members. So whether the group members are similar to one another, whether they share the same experiences, or whether they are different from one another. So heterogeneity and the homogeneity is another important factor that determines the effectiveness of the group counseling. Sometimes you need heterogeneous group so that the multiple perspective of the problem can be seen. Sometimes the homogeneity becomes an important factor, because when you say heterogeneous, as I some time back just told you, heterogeneous, I don't know who the other person individual is. And when I don't know the other members, I have my own reservation in sharing my experiences. At times, it is necessary to have the homogeneous group so that
1 week I give.
so that people can relate themselves to the other group, so that other members of the group, so that they can share the experiences very easily without emotional or without any other reservations are concerned. So that is where the heterogeneity or the homogeneity factor. The third factor that determines the effectiveness of group counseling is the group size. What should be the size of the group? Now, you can't say that the group size, group counseling can be for an entire class or entire college or entire office. So the effectiveness of group counseling tend to depend upon what is the group size. Ideally, the group size effectiveness of the group counseling depends upon the group size. Normally 8 to 12 would be the ideal, let us say, group size, so that every participant can have sufficient time to share their experiences. If the number of individuals are more or the group size is more, every individual may not have sufficient time to participate in the process of, let us say, sharing is concerned. That is where you can't say that the group counseling can be hours together. So that is where the time is also an important factor. The time there would be at one aspect of dimension of time is when exactly is being conducted, and the second would be what is the duration for which the counseling session is being planned is also another factor. So you can't have group counseling session for hours together. So that is where group size of 8 to 12 is considered as ideal for the effective group counseling process is concerned. Next one is the group dynamics. Okay, I was talking about heterogeneity and homogeneity. Now, when you talk in terms of heterogeneity and homogeneity, how exactly the group operate in a group session is an important factor. So probably we are all, the teachers may know this. Now, suppose, for example, you throw open a question, right? Initially, nobody will speak out. And when it takes time for one individual to initiate, and when once that particular individual starts initiating, others also will participate. And who is that individual who takes the initiative is another important factor. And if it is, say, for example, an office, or if you take, for example, let us say a group of students, and if that let us say group has a group leader or a monitor, or if the, let us say, supervisor or a manager is a member of that particular group, then what will happen? So the mere fact that the manager is also a member of this particular group, and if the issue is related to the managerial practices or the leadership factor, then what will happen? The process itself may be affected by that. So the group dynamics is another important factor. Whatever you may say, or the manager says, others tend to accept, can blindly say that I also say the same thing. This is where the group dynamics is another important factor, and the socio-cultural background of the clients is another important factor. So the socio-cultural background of the counselor, socio-cultural background of the clients is another important factor. Now, what do you mean by that? As just now, as I said, if the counselor belongs to totally a different culture, as I explained, say an American talking to, let us say, an Indian culture, recipients of residents of Indian culture. So what happens there? Okay, so that is where I may not feel free, I may not be able to accept what the other individuals say. Okay, so similarly, socio-economic background of the participants also. So socio-economic background of participants also affects the group dynamics component is concerned, and that is where the socio-cultural background play an important role. So these are some of the factors that determine the effectiveness of the group counseling is concerned. Now, when we talk in terms of group counseling, we find that two challenges that the counselor may have to face. The two challenges are, one, certain members may become silent. They won't participate at all. Certain members, on the other hand, may always talk. So there are certain members who won't talk at all. There are certain members who always talk. And both of them are not effective. So you have to handle these two individuals. One who doesn't talk, you have to encourage him to talk. And when who talks, you should cut down on him to speak less. So what are the strategies that you have to follow in order to make a silent individual to talk? What are the strategies you may have to follow when two talkative individual to talk less? Okay, so some of the, let us say, tips for these two are, now, if an individual is, let us say, is more silent, not talking at all, now, what are the steps that you can take? So the first one, use an icebreaker that involves a lot of interaction. Okay, so start with an icebreaker, start with a small game where, you take the entire group into a sort of a common plane. Okay, so there are lots of ice-breaking exercises that are there, and if you follow any one of them, what will happen? Initial reservations and hesitations, inhibitions that individual may have can be handled together. Okay, so the first factor would be make them comfortable through an icebreaker or an ice-breaking session or an ice-breaking exercise. That is the first component. Go round robin in the group whenever appropriate, asking each person in turn to share a comment. Round robin technique. So what do you mean by round robin technique? You raise a question, you come out with one particular idea, ask the opinion of every individual in a round robin manner. Round robin manner means 8 individuals are there. Ask the first person to give his idea, then move to second, third, fourth, fifth, sixth, seventh, eighth, so that everybody will be will be made to express their opinion, and not that you ask a question and allow anybody to talk. So follow a round robin technique so that it would be possible for these silent speakers also to come out. So that is the second factor, or the second point that you can take care of. The third one, ask the quiet person specific questions related to his or her, let's say, expertise. Okay, so what happens there? The type of questions which you ask should be directly related to that individual, where you find that that individual has a lot of potential. Okay, so what happens there? It is not a generic question. It is a specific question which the counselor feels that the individual or a silent individual may know the answer or may have a better idea, so that, in this particular situation, how exactly you would like to you have reacted, or you would like to react, and etc. So that's another way in which you can boost the morale of the, let's say, person who is silent. Distribute cards in advance for written anonymous input. So what happens there is another strategy. An individual may not be able to verbally say something, but what happens? You distribute the cards, you distribute the slips of paper, ask them to write their views without mentioning their names. So anonymity can give them some confidence so that they will be able to participate effectively. So distribute cards or distribute the sheets and ask them to respond, ask them to give their opinion without writing their names or keeping anonymity, their names anonymous, or keeping it confident. And give the group a few minutes to think silently before asking for responses to some questions or tasks. Okay, so ask a question, allow some time to think, so people to think over and then try to give an answer. Do not asking question and immediately do not ask the individuals to respond. So these are some of the ways with which it would be possible for you to make a silent participant to participate actively. So, okay, so that's one factor. Now, how to deal with a person who always talks or who wants to talk always? Okay, so this is another, let's say, extreme case which we can have. So some of the aspects that you can do to deal with the individuals who talk always are: first one, establish and enforce ground rules. So before you start the proper counseling session, say that your answers should be, or your comments should be very brief, and you should develop the sense of listen than talk. Okay, so first of all, have the patience of listening to what others say and then talk is one. And you can speak a second time after everyone has spoken once. Okay, so this is one factor. So this can be, the ground rule can be that you are allowed to speak, and then the second chance will be given to you or given to any member only after all other members complete their giving their opinion is concerned. So setting up of the ground rule is one. Interrupt the talker and offer to talk to him or her uh, after the meeting. So tell him or tell her that I know what you are trying to say, but let us discuss this afterwards. So when the time is there, at the end we will talk, or privately we can talk on this particular issue is concerned. So interrupt the talker in between and then tell him that, or tell her that you can talk to that particular person after the meeting. Put a time limit on each person's comments for each topic and enforce it. So probably you can ask one of the group member himself or herself to act as a timekeeper. Okay, you can, in the ground rule itself, you can say all of you are allowed to speak initially for about 5 minutes or 3 minutes, depending on the duration that has been planned. And at the end of the 5 minutes, the timekeeper will say your time is over, and you have to shift over to another individual. So if the time permits, later on the individual, the second round can be brought in. So put a time limit on each person's speech or a talk, and then ask another individual to keep time. The timekeeper will manage the time process is concerned. And another way would be ask the people to raise their hands to speak. So what will happen now? Even though the individual wants to talk, you can say that, look here, there is another person also who wants to talk, so that we will listen to him or her first and then come back to you later. And talk to the person privately and explain that you would like to get more people participating. So the entire process is that I understand your concern, but we also, the solution to this particular problem is better when others also equally participate. So these are some of the, let us say, the factors that can be used to handle individuals who are silent or individuals who are more talkative is concerned. Okay, so this is another factor. And some of the ethical issues that we need to take into consideration. So what are the ethical issues that a counselor may have to consider while doing a group counseling is concerned? So the first one would be non-maleficence or beneficence. Okay, so non-malevolence or beneficence. So what do you mean by this? That means you cannot have a bad intention towards any individual or towards a particular person. So your personal or group's personal subjective biases should not be encouraged. So that is one aspect is concerned. Beneficence. So suppose, for example, if a school authority asks you to conduct a, let us say, a group session or a counseling to deal with a particular problem. Okay, so you can't, address the entire issue from the for the benefit of the school or the benefit of the teacher is concerned. Or similarly, at the workplace, if the management tries to say that you have to deal with this particular issue, your approach should not be to benefit the management. Okay, so this is where you talk in terms of maleficence or beneficence is a factor. And all of us are familiar with the counseling, whether it is individual or a group counseling, or even say, for example, psychological assessment component also. Informed consent is another major factor. Ethical issue would be informed consent. So ask the participants that you are willingly participating in this particular process of counseling is concerned. Group policies. So what are these, let us say, group policies that, how this particular group policy, ultimately when you arrive at it, what are the factors that the group members has to adhere to this particular group policy is a factor. Autonomy is a respect for a client's free will. Okay, so this is where non-threatening environment, creating a non-threatening environment becomes an essential factor. So autonomy, each individual should be given an autonomy to express his or her personal opinion. So that's an important factor. That can be possible only when you provide a non-threatening environment is concerned. And professional commitments, honoring the professional commitments is an important factor. So when you have a heterogeneous group, and when the composition of the heterogeneous group are, let us say, of different nature, different occupations, different age group, and etc. So honoring the professional commitments of the individuals or the participants, as well as of the, let us say, counselor, play an important role. So one may be a common man, common citizen, one may be a doctor, one may be an expert, one may be whatever that. Despite those individual differences, honor those individual differences is a factor that becomes essential. And commitment to the truth or the veracity is another factor that need to be taken into consideration. So, ultimately the goal is to, the truth is an important factor. So it's not, something which is, on a face value, you come out with a particular solution or a particular resolve that particular problem, but the validity and the truth is a factor. Justice is another ethical issue that we need to look into. So professional commitment to fair and egalitarian treatment of clients. So when you are dealing with the clients, it's not that, in a group, 4 individuals are benefited, 2 are not benefited, or ultimately the policy or the solution which you arrive at should be equally effective to all the members are concerned. So that is where fair and egalitarian treatment of the clients is a factor. And self-respect, I think we have already talked about self-respect of the counselor is also an important factor. The last aspect which I would like to highlight on is the word of precaution. What are the, let us say, precautions that a counselor may have to take during the group counseling? The first one, groups can become toxic and create a space in which counter therapeutic behavior can take place. Now, this is one factor. So when you have a group, and when in the process of sharing or expression, it may come out or it may result in a conflict. It may the entire process of debate and itself may have the potential of creating a conflict or becoming toxic. So though the purpose is to resolve the issue, in the process of resolving, it may result in conflict and become toxic. Okay, so you should be careful as to the probability of the entire conversation, entire process may turn out to be toxic, and counselor may have to be very careful in dealing with this particular issue. So one is group can become toxic, and then counselor should be very sensitive to know the point where this is going out of stray, and then you may have to regulate or have control over that particular group session is concerned. So that's one. It's also too easy for group leaders to become victims of their status. So normally when you have a group leader may become victim of that. Everybody may start, let us say, pouncing on this particular group leader. So it is because of you that's happening, and poor group leader may become the victim of that, and that you may have to handle that particular situation. And a counselor is naturally invested with a greater magnitude of influence and responsibility. So what happens if the nature of the group I was talking about, and whatever the counselor may say, this can happen when you are dealing with a younger group is concerned, students are concerned. What will happen? Whatever the counselor may say, the students or the younger group may say that whatever counselor said is right and the ideal thing, and they may start blindly accepting whatever the counselor may say. So that's a factor. So judgment becomes, they may not think in terms of the other way, and whatever you say it is right, they may say. So that's an issue that you can look into, or one may have to be aware of. And then you should foster a diligent practice of self-reflection. Counselor also, during the process of let's say group counseling, should involve in self-reflection. What exactly is happening? What is my role in this particular process? Am I making a value judgment? So self-reflection is another factor. And examine ethical issues related to your authority by referring to another authority, whether you have the autonomy or the authority to deal with this particular issue, or you have to take the consultant or take the opinion of the others also, especially when you're talking to the group counseling in an organizational setup, work setup. You can't say that, this has to be, policy has to be changed. You may only suggest the authorities that this policy need to be changed, and it is that particular management may have the potential to, let us say, bring about a change in the policy. You can't say that I will bring about a change in the policy. So that's one. And it may be useful to develop a clear code of conduct and emphasizes commitment to group beneficence through mutual respect is a factor. So that's where, it's always essential at in the very first beginning, initial stage itself, ground rules have to be very clear. And if you are very clear about the ground rules, lay the ground rules, and all the participants adhere, accept, and then also vote for, adhere to these ground rules, then the effectiveness of group counseling would be possible. I think all of you are familiar with the advantages and the disadvantages of group counseling. I don't want to repeat that particular factor. Nowadays, because of the various changes that are taking place in the several of institutions, whether it is formal institutions or informal institutions, people want a sort of a group to confess in front of a particular group rather than an individual is concerned. The type of issues that individuals are expressing, whether it is a personal, it can be in terms of stress, it can be in terms of academic component is concerned, or work-life balance component is concerned, or whatever the issues that are there, the need for group counseling has been felt, and that is where the scope for group counseling is also there. No matter in the process of group counseling, you may make use of several techniques that are being used, and you should be judicious in using those techniques are concerned. I thank the organizers for giving me an opportunity to share some of my experiences. Thank you very much. Any questions, clarifications? Probably if I know, I'll be able to answer those questions. Thank you very much. Over to the organizers.
Good evening, sir. I am
Yes.
Hemla Kathar.
Okay.
Sir, what about the problems? Because in a group counseling, different people will be having different problems, no, sir.
Yes.
How to cope up with all of them at a time, sir?
Okay.
In a
Okay.
group.
Okay. See, that's what I said. So at one setting, problems of all individuals cannot be handled at all. That's one factor. So in the ground rule itself, you have to say, what is the problem that is of more common to all of them? and try to prioritize. And we are dealing with this particular problem now, and the common problem can be identified. This is one factor. If the group is willing to come for let us say few sessions, then you can say that on the prioritized problems, we will be continue dealing with these particular problems. So it is not humanly possible to address all the problems in one setting, all the problems in a factor. So in the initial stage itself, identify what is the common problem most of the members are experiencing, prioritize, and then try to deal with it.
Thank you, sir. But the age group of the issue holders also will be different, no, sir?
That's what I was saying. So
Yes, sir.
whether you have a heterogeneous group or a homogeneous group is a factor. Okay. Whether the clients come to you on their own to you, or you are organizing a group counseling, may take care of. And if you are organizing, then you can say that I will organize the group counseling for a homogeneous group. Okay. Or you may prefer a heterogeneous group. Okay.
Sir, Professor Ashok, sir,
Yes, sir.
I am just having a small doubt.
Okay.
Can all problems, can we go for for all the problems group counseling, or is there any problems left over not to go for group counseling?
Yeah, that's what I said. See, depending on the need. Okay. So there are purely subjective experiences or the subjective problems. And for those subjective problems, individual counseling would be better. Okay. Whereas if the problem is of not that subjective factor, again, how do you differentiate this? Because an individual may have a problem, but he finds it more comfortable in a group session rather than an individual.